Hi everyone, my name is Reema Patel, and today I will be talking about the cytomegalovirus and the risk it poses as a silent threat. So, first, a little bit about me. I am a rising senior at Langley High School. I'm the president of my school's medical club, and I participate in Best Buddies and Hearts for Hospitals. I'm also part of my school's Math Honor Society, English Honor Society, and National Honor Society. I'm also the founder of a nonprofit, Siblings of the Exceptional, which is a nonprofit dedicating to helping siblings with special needs and their families. And in the future, I hope to pursue a career in pediatric medicine. So, what is cytomegalovirus? Cytomegalovirus, or CMV, is a common virus that causes infections. Most people who are infected with CMV aren't aware because it appears asymptomatically. However, this virus can pose a severe threat to infants and individuals with weakened immune systems. CMV is one of the largest viruses of the human herpes viruses. This means that after being infected, it stays in one's system lifelong. CMV is transmitted through direct contact with infected bodily fluids such as saliva, urine, blood, and can be passed through organ transplants and other modes of transmission as depicted in this figure. Types of transmission are divided into vertical transmission, where the virus crosses the placenta during pregnancy, infecting the fetus, prenatal transmission, where CMV is spread during childbirth, and postnatal transmission, where there is contact with infected bodily fluids such as saliva in a social setting or facility. This makes individuals who work with children at a higher risk of getting CMV. Among infants born with CMV, 10 to 15% who are asymptomatic at birth later develop complications such as hearing loss or developmental delays. Asymptomatic infants often face more severe outcomes, including microcephaly, intracranial calcifications, and cerebral palsy. Regarding its structure, the CMV virus is a linear double-stranded DNA virus characterized by 230 to 240 kilobase pairs encoding over 200 proteins. The virus first infects the body, then becomes dormant in myeloid cells and can reactivate if the immune system is weak. The virus enters host cells through two main pathways: fusion with the plasma membrane in fibroblasts, mediated by glycoproteins GB, GH, and GL, and endocytic and pH sensitive pathways in the endothelial and epithelial cells. After entry, CMV replicates and activates its genes, arranges and packages new virus particles, and completes maturation before being released from the host cell. So, why is CMV a global threat? Well, according to the CDC, CMV is the leading cause of congenital disabilities in the US, with 1 in 200 infants being born with congenital CMV each year. Of these cases, around 10% of infants exhibit symptoms at birth, including hearing loss, vision impairment, and neurodevelopmental delays. By exploring CMV's biology and clinical significance, it is important for individuals to be aware of CMV's ability to be benign for many and yet detrimental for others who are vulnerable. Globally, there is a pattern between CMV prevalence and different geographic locations as well as socioeconomic status. For example, higher rates of congenital CMV are observed in low and middle income countries. In sub Saharan Africa, CMV ranges from 1.4 to 6 compared to the global average of 0.67 in seropositivity. In the US, statistics display how CMV seroprevalence increases with age, with higher rates in females. In Canada, having one child versus two or more children was linked to increased CMV seropositivity. Differences in family size or childcare practices between two countries could contribute to the disparity in seroprevalence rates. However, there are a few gaps in this, including limited number of population-based studies in Canada, which has led to reliance on data from other countries for seroprevalence estimates. Additionally, the magnitude of CMV-associated mortality risk remains uncertain, particularly in some high-income countries. Depending on the amount of citizens that are already infected by CMV, the risk of transmissions can change. And all of these uncertainties with CMV have made it more of a global risk, along with its asymptomatic or latent tendencies and its less global awareness. There is no prevention for CMV, but there have been clinical trials with potential vaccine development. As of now, researchers are investigating the cellular processes that enable CMV to establish its dormancy and permanent part of its host lifespan. One key area of focus is the role of myeloid progenitor cells in the virus's replication and spread, which could provide insights into how CMV manages to avoid the immune system's response over long periods. To help those with weaker immune systems, antiviral medications like ganciclovir and valganciclovir are administered. CMV's severe negative effects on certain populations, such as infants born to mothers of lower socioeconomic status, highlight the importance of equitable access to healthcare to prevent its spread and develop more efficient treatment and surveillance strategies for CMV. The virus also results in irreversible damage to infants, such as hearing loss or neurodevelopmental issues. To help combat all of this, it may require speech or occupational therapy and assistive devices like cochlear implants that affect an infant's lifelong. In summary, cytomegalovirus can range from being asymptomatic to resulting in irreversible disability. Those who are at higher risk for CMV are infants, women who are pregnant, and those with a weakened immune system. Although there are some antiviral medications that can be taken to help those with a weakened immune system to directly combat symptoms, it's quality to establish latency lifelong and hide from the immune detection makes it more of a challenge as it's hard to be aware of. Currently, there are no approved preventions for CMV, but clinical trials are underway to help develop effective vaccines to prevent CMVs. CMV's disproportionate impact on infants born to mothers of lower socioeconomic status also needs to be addressed, and there needs to be more equitable access to healthcare, increased awareness, and better screening and treatment for those that do have CMV. In cases where CMV leads to hearing loss or developmental issues, individuals will be required to have long term support with therapy and technological devices. And in the future, it is important for people to be aware and educated about CMV and for there to be continued research in order to combat the CMV's global threat. These are the references that I used for my research. I'd like to say thank you to Professor Ajla Morate for helping me gather research and understand CMV, and the Global Health Leadership Conference for this amazing opportunity to present about the cytomegalovirus. If you have any questions, feel free to contact me. Here is my information. Thank you.